In this video, we discuss one of the most controversial topics in cancer treatment, Stanislav Burzynski's Antineoplastons. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Antineoplaston is a term coined by Dr. Stanislav Burzynski. Antineoplastons are synthesized versions of peptides found in human blood and urine. They are present in people without cancer in much higher numbers than in people with cancer. This led Dr. Burzynski to speculate that they might be beneficial to administer during cancer treatment. Dr. Burzynski compared antineoplastons to microswitches that turn off the cancer process. As you will see in another of our videos, neoantigen vaccines, peptides are having a great deal of success doing exactly this. Dr. Burzynski was ahead of the curve by decades in pursuing peptide treatments for cancer. He also used a roundabout, frowned-upon way of getting approval to administer his drugs to patients. He got Institutional Review Board approval to administer his drugs, and his protocols for the trials were approved by the FDA. Yet he had dozens of these protocol trials approved, and he hardly ever reported results. The approval of the trials was used as legal cover to run a private for-profit clinic administering his investigational drugs, certainly against the spirit of the clinical trial process. The FDA was so displeased that they actually brought criminal charges against Dr. Burzynski for administering unapproved drugs to treat cancer. Facing many years in prison, Dr. Burzynski bravely took the case to court and was found not guilty on all accounts. However, the tumult around Dr. Burzynski's criminal proceedings and the circumstances of his clinical trials have overshadowed the discussion of antineoplastons' efficacy, because the criticisms around antineoplastons center largely upon Burzynski himself and the way in which he ran his trials clinic. We are going to limit the discussion of antineoplastons to studies conducted by people other than Dr. Burzynski himself. In fairness, however, Dr. Burzynski is a voluminous publisher of his own case reports. Dozens of his own case reports show extended survival in nearly every cancer type, including a case of 27-year survival of DIPG, the most lethal form of cancer, a cancer which typically affects children. Findings of antineoplastons not conducted by Dr. Burzynski include a Phase 2 trial out of Japan found tested antineoplastons A10 and AS21, the most clinically researched of Dr. Burzynski's antineoplastons, in patients with colon cancer with liver mets. 32 patients received antineoplastons along with chemotherapy, while 33 just received chemotherapy. Although overall and relapse-free survival were not statistically improved in the antineoplaston group, cancer-specific survival was. The cancer-specific survival in the antineoplaston group was 67 months versus 39 months in the control group. At 5 years, 60% of the antineoplaston group was alive, compared to 32% in the control group. Also, when cancer would recur, it recurred in fewer organs in the antineoplaston group. The same group out of Japan published a case report of antineoplastons contributing to a complete remission of metastatic colon cancer. 8 years after initial antineoplaston treatment, the patient remained cancer-free. An animal study found that AS21 significantly extended life in a mouse model of colon cancer with lung metastases. A cell line study was also published showing AS21 inhibited colon cancer growth. Another Phase 2 trial out of Japan tested the effects of AS21 in 10 hepatocellular cancer patients. These patients were given AS21 for certain lengths, then they were taken off for certain lengths, so in a sense the patients were their own controls. Recurrence-free intervals were significantly longer during antineoplaston administration than without, 16.2 months versus 5 months. Another case report described a man with a progressing 7 cm X, 7 cm liver tumor refractory to transarterial embolism who received a 10 and AS21 as a monotherapy. He experienced 15-month disease control with Antineoplastons as a monotherapy with minimal adverse events. A case report out of Japan found a clinical benefit from administration of a 10 and AS21 in 2 cases of advanced lung cancer and another case of advanced thalamic glioma.